Welcome to another episode of the Who Cares podcast. We're here to talk a bit more about how to prevent infections in care settings. This time we're going to focus on vaccinations and how that can help. Just to introduce ourselves again, my name's Kirsty. I'm a public health specialist. I work for Devon County Council.
Hi, I'm Holly. I'm the clinical lead for the vaccination optimisation team for NHS Devon.
Hi, I'm Tina. I'm the infection prevention and control lead for NHS Dorset ICB.
And I'm Charm, one of the consultants working for the health protection team at UK Health Security Agency.
Brilliant. So we've talked a little bit saying how vaccinations are really important because they, by the very nature of them, they're helping us prevent infections from happening. We want to talk a little bit about the vaccinations that are available for both residents and for clients in care, and also we'll go on to talk a little bit about staff. But if we start with the vaccines, Holly, do you want to give us a bit of an overview about which ones are available and what?
Yes, absolutely. So you may find your residents of a care home, or if somebody's visiting their client at home, if they're an elderly person, you may find that they're eligible for different vaccinations compared to a younger person. But predominantly we'd be looking at flu, COVID, RSV, shingles and pneumococcal vaccines. They're the most common ones, but certainly in the winter we really do focus on our flu, COVID and RSV.
So the flu one last year was really effective, wasn't it? And it prevented around about 100,000 hospital admissions, the flu vaccine in our residents last year. And also the RSV is available obviously for different age groups, but in our older people we've got the data to say around 82% effective in preventing hospital admissions. So both of those showing really good outcomes for the individuals that are having those vaccinations, aren't they?
Yeah, absolutely. It's really important that people take up their flu vaccine. If anybody's eligible for their flu vaccine, we must support our care home residents, our clients at home in accessing that vaccine. It might be that teams come into the home, into the care setting and deliver those vaccines alongside the COVID vaccine. But flu is really, really important. It's easily spread. People can die, especially if you're vulnerable. In England alone last year, we did have, let me quote my figures right here, very high numbers of flu deaths still. 7,757 deaths in England last year, and 53 paediatric deaths as well. So it's just important. Although we did prevent hospitalisations, it's really important.
We can still do better, is basically what we're saying, isn't it? And actually the more people we vaccinate, the better uptake, the more effective we can in stopping it circulating. So I think that's the other thing, isn't it? There's some vaccines that we have once and we may only have them in childhood and they last us. We might need to have boosters in an older adult age, but actually some of these we have to have more regularly, don't we? So the flu is an annual vaccination, isn't it, Tina? So there's a reason for that, isn't there, over the others. So it's about dealing with the different strains, isn't it, each year?
Absolutely. Every year you need another flu vaccine. It's a slightly modified vaccine each time, and that's to protect against the current flu virus that they're expecting to circulate that coming winter.
Yeah, and that's very often I get asked question, I've had the influenza vaccination last year, why do I need it this year? So it's really understanding of, like you mentioned, the viruses are so clever and they can adapt, and the strains that we see and they change on a regular basis. So, the message is really important. Every year you should be vaccinated to make sure that you can protect yourself and others.
No, absolutely. And people shouldn't be afraid of having those vaccines. And some people say, oh, I've had too many vaccines. There isn't such a thing as too many vaccines. You must always take up what you're eligible for.
And we have generally, in Devon at least, don't we? We have pretty good uptake of our flu in our older people. Most of our vaccine uptake in our older people is generally quite
actually
good.
Quite high, yes.
Yeah, but it's not just about the residents and our clients, is it? It's about our staff, because there are vaccines that are available to people who are working with our most vulnerable populations. So do you want to go over the ones that we're going to mostly... So again, we're vaccinating against flu in our care staff.
Yeah, absolutely. All our health and social care workers are all entitled to the flu vaccine. Now that's whether you're a paid care worker or somebody who cares for a vulnerable person, you're entitled to that flu vaccine, and you should be taking that vaccine up, accessing it, either if you have an occupational offer through your care setting, a pharmacy, or your GP surgery may offer your vaccine as well.
Can I ask a question? So if you're if you're a son or a daughter and you're looking after somebody who's elderly, are they eligible as well?
Yes, they
Yeah,
are.
so
Yeah.
anybody, it doesn't have to be
Yeah.
their profession.
Yeah.
No, and you don't have to be paid. So if you went and explained that you cared for somebody that was vulnerable, it's so important because although an elderly person may be in a care home or at home and isn't able to go outside, you're actually bringing infections into their environment. So by you protecting yourself, you're actually protecting those that you care for as well.
And how would you say they can access the vaccination if it's a son or daughter, like you mentioned, looking after their parents?
They can go to a pharmacy, they can go to their GP surgery, even a vaccination site if they're eligible for other vaccines such as COVID, if you've got a health condition that warrants that as well.
And the important thing is it's all free, isn't it? So
Absolutely.
everybody can access this vaccine, the flu vaccine, for free if they're in the eligible cohort.
Yeah, it's just being, the teams will support you in letting you know whether you're eligible.
Yeah. So there's other vaccines as well, aren't there, really? And actually, to go back to the flu, the really important thing is, and we're talking about our really vulnerable residents and our clients, why then as the care staff, why are we asking them to be vaccinated? They're probably thinking, well, I'm not vulnerable, my respiratory health is really good, I'm fit, I'm healthy, I'm young, I'm not particularly at risk. Why is it important, if I was a care worker, for me to get a vaccine, even though I'm not particularly vulnerable myself?
Well, nobody can ever say they're definitely not going to get flu.
Yeah.
I've been a nurse for 25 years now and I've had flu on 2 occasions, and I felt terribly poorly. It was a long time ago, and I was put to bed for a whole week. Now, flu is really nasty. So firstly, nobody's invincible. Anybody can get flu, but it's really important, even if you're thinking about protecting yourself, you're protecting others around you. There's certain people that can't have vaccines. It might be because they have a weak immune system, so certain vaccines like the MMR vaccine, but also certain age children can't have a vaccine. So there are other reasons that people can't be protected themselves, but it also protects you from taking that infection into them and spreading that around, and also keeps you at work as well. If you're off sick, then your care home are one staff member down, and that has a really big impact on a care setting.
And I guess also if you're a carer at home, if you're unpaid and you're sort of caring for a family member, actually again, it's really important, isn't it? You want to be able to care for that person. You don't want to have to take to your bed for a week and leave that person potentially a bit vulnerable without that support that you would normally give them.
Yeah,
and essentially what we're saying basically, we have generally good uptake in our residents. We know our staff, we could do more around getting our vaccination up. Again, with children as well, they're eligible, getting their vaccine up. The more people we can get vaccinated, the less flu we'll have circulating in the community. That, again, in time, all brings down that risk to everybody around us, doesn't it?
Yes, yeah. You think about everybody mixing at Christmas time, all the families of different generational ages, they all come together, and those children are bringing those bugs into that
Lovely
family
children,
unit.
aren't they? They are
The
little super spreaders.
But really important that we optimise our vaccination rates.
And again, for our staff, it's every year, isn't it? We want them coming in, we want them having that every year alongside the residents so that they're fully protected. They're getting the vaccination against the new strains as well that might be coming in.
That's right.
So what about other vaccines then? Because we've talked a little bit about our staff and our flu. Some vaccines aren't available to our staff that are available to our residents because of the level of vulnerability and the way that we respond to things. But we know that we can all access the MMR, well, we don't know, we can all access the MMR vaccine. Why is that really important as well for our care staff?
Well, firstly, you don't know if you've had your MMR as a baby unless it's on your records, so it's really important just to check that you've had your measles, mumps and rubella vaccination. You may be considering starting a family. Once you fall pregnant, you can't have the MMR vaccine. It's not recommended in pregnancy. And also, as we mentioned before, those young babies, the under 1-year-olds, can't have the protection of the vaccine. So making sure yourself and the other family members have that vaccine. It may result in time off work again, and also measles, we do understand it does spread very easily, and without everybody being vaccinated and us getting to those World Health Organization rates of over 95%, which provides the herd immunity, we are putting those at risk who can't have the vaccine. And you think about those people on immunosuppressive treatments such as cancer treatment, their immune system isn't working the way it used to, and they could be more vulnerable to catching measles, and they can't have the vaccine.
That's the key thing with vaccines, isn't it? You're really helping that herd immunity, and through that you are really protecting the most vulnerable people in your community.
So that herd immunity is essentially what we're saying, isn't it? Is that the more people in the community that have the vaccine, the less chance we have of that disease or infection spreading in the community. And if we can then get that as high as we can for those people who can't have it, because there are people who genuinely can't medically have it, that helps protect them, doesn't it?
I mean, obviously the individual gets protected.
Yes, obviously.
But it's an unusual medical intervention, if you like, that not only are you helping yourself, you're helping others as well.
Yeah. And actually the trickiness with the MMR vaccine is that because it's so good, we don't see measles, mumps and rubella like we used to, did we? But this past year at least and beyond, we have seen quite a lot more measles outbreaks, haven't we?
We have, we have had some across the country. Even in the southwest, we did have some, and some of that might have been because of missed appointments during the pandemic. But things have settled down a bit. But I think the thing is, Holly, if you lose sight of the aim and you just let your guard down with vaccination, infections can come back. So that's the thing.
That's what we're seeing, isn't it? Our coverage across the country has dropped.
Yeah.
In some groups more than it has in others, and actually what that's meaning is that there's the opportunity for it to circulate.
Yeah.
So with the MMR then, we know children tend to have it as part of their childhood vaccinations, and people may well have missed that. Anybody can access that now, can't they? So if you're not sure that you've had it, how do you go about checking, and what?
You can go to your GP surgery. They'll have all your records, and if they don't see a note on your records, on your vaccine history, that you've had 2 doses of the MMR vaccine, then they can offer it to you completely free. Irrelevant of immigration status or residence in the UK, everybody can access free NHS vaccines. We also are able to offer vaccinations such as the MMR without the porcine gelatin in them as well. So there is another brand that you can have if you have religious beliefs that you won't you don't feel that you can take the porcine.
That's really good. It's really
vaccines.
inclusive, isn't it? So it's open to
Absolutely.
everybody. So I think that's our message, isn't it? Really, actually, we've got probably quite a lot of young staff who there is a possibility that they've missed it or they might not have had both doses. It is really worth checking, just for their own health, for business continuity, making sure people stay well, but also then for their families as well at home. So thinking about our staff in our care homes, we know in Devon we've got quite a few care homes who have quite a lot of staff that come from overseas, and they come here and they settle and they are working wonderfully in our community. We encourage people to register the GPs. How does that work in terms of vaccinations? If I've lived abroad and I've had some vaccinations there, what do I need to do when I arrive here?
So the best thing to do when you register with your GP is take any history of vaccinations with you. So whether it's a card or a piece of paper, or if you just know you've had certain vaccines, and you tell your GP surgery and they can enter them onto your record, and then they can compare them with the UK vaccine schedule. So if you've come from a country that has a different schedule to ours, what we may do is top you up with additional vaccines. So for example, some people might recognise that they have had oral polio vaccines in their country. It's really, really important to have the inactive polio in our country and make sure that you've had enough doses to protect yourself. And that goes across all of the vaccinations. You may have had more vaccines in different countries, but other diseases that we don't have in our country, but and it goes the other way. We need to protect you against diseases and illnesses that are in our country.
That's why it's important, isn't it? Because some countries have different things circulating that we don't, and then we equally have things that circulate differently. So it's just getting everybody to a kind of a level playing field so that we're all equal in terms of what we're being offered to keep us all well and to keep us healthy with the clients that we're working with.
That's right. You think about travel vaccines, when we go on holiday to another country, we go and have special travel vaccines to protect ourselves from diseases in other countries.
So the flu vaccine, going back to the flu vaccine this year, when does the availability start of it? Because it's slightly different, isn't it, for children and for adults?
So children and pregnant people are able to access their vaccine now. So that started from the 1st of September. As of the 1st of October, the general population who are eligible, so that's the clinically extremely vulnerable, the immunosuppressed, the carers, the frontline healthcare workers, the elderly, anybody that is eligible for the flu vaccine will be able to get it from the 1st of October. If you're about to start immunosuppressive treatment for the first time and actually you have a clinician that says you're better off receiving it early, then you can get some special support in receiving your vaccine early. But often, for most people, it will be from the 1st of October.
And so people can go online and book that, can't they, with their pharmacy or their GP or with the vaccine clinics as well?
That's right, yeah. So MBS is open now, and you'll be able to select various locations where you can receive your vaccines. GP surgeries have probably already texted you, so where you can, feel free to go to your GP surgery. They've got the vaccine, or if it will be arriving soon, they'll be running clinics. They try and put on several different types of clinics to make it accessible for people. And also think about those around you, your 2 and 3 year old children. Really, really important that they get their vaccine. When it comes to your school age children, you'll find that you'll get a consent form come through on an email via the school, and you can consent online for your children.
And it's slightly different for children, isn't it? So when we talk about flu vaccination for children, we're actually not talking about an injection for them, are we? It's slightly different.
No, if they're eligible, most children will actually have the live nasal flu spray. So just a little a squirt up each nostril, and the immune response for children with that vaccine is actually optimum. So they're better off having that one if they can. But there are some children that simply can't have the live vaccine, and that might be because they're on immunosuppressive treatment and just aren't quite well enough to have a live vaccine.
So again, speak to your GP if
Yeah,
you're
absolutely.
worried about that at all.
And same again for the porcine gelatin as well. If you feel that they can't have the live flu vaccine, there is an alternative which the school age immunisation team are able to offer.
And it's really easy to do the consent, isn't it? I mean, I do it. I get an online link. It takes less than a minute.
Yeah, absolutely.
Really,
and it's really important
well
that
spent.
you do
It's
give that
really
consent,
important.
isn't it? And
Yeah,
especially when they're younger, but they get a little bit older, they can consent for themselves if they need to. But just by having that in place, it makes it so much easier for the nurses when they come in.
Absolutely, it certainly does. Also, if you really do struggle, then there is a telephone number that you can access, and that will be on that email, or the school will be able to offer you that number, or your GP surgery.
Brilliant. So I think essentially we've talked a lot, haven't we, about preventing infections in lots of different ways. Vaccinations are very much our go-to. If we can get this right, then we're going to be preventing stuff circulating in the community. It makes all those other things that we're doing to prevent infections work that little bit better. So in terms of the flu, really, if you are eligible, our ask really is to go and get yourself booked in and take that appointment and get protected for the winter.
Yeah, definitely.
Thanks, everybody.
Thank you.
Thank you.